Hi, it's a pleasure to be here. I'm Emily Ozer. I'm a professor here in the School of Public Health, and I'm going to turn it over to start to Vicky Gomez, who will introduce herself.
Hello, everyone. Thank you so much for joining us today. I'm Vicky Gomez. I'm in the last semester of the Doctor of Public Health degree here. I chose, I chose specifically to come to UC Berkeley so I could study community-based participatory research with professors Mary Minkler and Emily Ozer. And I was fortunate to take the last class in 2014 that Mary taught, and now I get to co-teach alongside Emily as the graduate student instructor. So what is community-based participatory research, or CBPR for short? CBPR is an orientation to research with the commitment of working with communities and not on them. CBPR works well with both quantitative and qualitative approaches, and it centers the community experience as an integral part of the collaborative research process. The community works with the researchers to address issues of power, to select the key issue and questions, determine the data collection process, interpret that data, and decide how the findings will be disseminated and in what actions will take place in order to benefit the community. Essentially, it is a long-term relationship. As a first-generation Latina born and raised in the Mission District of San Francisco, I insisted that my dissertation research have a CBPR focus. Involving the community in all aspects of the research, I knew that the intervention would be much stronger and relevant to the communities I was trying to reach. My persistence paid off, my committee agreed, and my research team and I have been working collaboratively with the Latino church community for the past 5 years to develop a culturally tailored intervention, a digital storytelling intervention to increase colorectal cancer screening intention. Church members with colorectal cancer screening experience developed digital stories consisting of their voice along with pictures to illustrate their story, and these stories were shared with the unscreened members of the church. Because of the community's expertise and guidance, we have developed an intervention that has been meaningful to the church community and has already attracted the attention of other churches on a local and state level and would like to develop and test these interventions. If you'd like to learn more about my research, please, I'll be here after the showcase, and I'd like to turn it over to Dr. Emily Ozer.
Thank you, Vicky. So you may ask yourself, although Vicky gave a very compelling reason why, but why to go to all this effort? Isn't it hard enough to do the outstanding and challenging health research that we already do? And when we think about it, I think about it from some different lenses and some different rationales. There's a more partnership power political rationale that's about really changing the traditional quote unquote ivory tower relationship, particularly that we tend to have with communities of color or low income communities where we're sort of studying from afar, and often the lens we bring is more of a problem or pathology based kind of lens. But there's also an important question and potential around the effectiveness of our work and the extent to which it really, we get better research and better interventions through these collaborative approaches. So I quote my colleague Rachel Morello-Frosch here in terms of what's the potential for these CBPR or community-based participatory approaches to enhance the rigor, reach, and relevance and in fact, the validity of the work that we do. So these are the questions that those of us who do CBPR here grapple with. So I am one of many, and there are many who are not, there are many in this room who could be on this slide, who are not on this slide, but we really are a community of researchers who do strive towards the most rigorous scholarship and also work that is community engaged science. And this is just a sampling of the kinds of topics and the communities with which we work both locally and around the world. I also come to this work as a psychologist. I trained here at Berkeley and at UCSF with a research program on adolescent mental health and school-based interventions. And many of us who are in this work come from multiple disciplines. So my focus has been on community-based participatory research with youth, or youth, we have a lot of acronyms here, YPAR, or Youth-Led Participatory Action Research. And so this would be the youth version in which young people are supported to pick a topic a health issue, they are one of change in their school or community. They're trained in a range of different kinds of research methods. They have a design, they gather data, they interpret that data, and then they focus on the kind of changes and actions they want to see in their schools and communities. And here's just a little graphic of what that might look like. So starting with important skills, you don't just throw people into it, but important skills of team building and power and working in groups and youth working with adults to support that work. Choosing an issue, whether that's cyberbullying or liquor stores, too many liquor stores in the neighborhood, or a range of different health equity issues, design and data, and then report back and change. So there's been, as Brenda alluded to, there's a lot of press and attention right now to youth activism and its potential role in improving health and well-being broadly. There's been a lot of growth in youth-led participatory action research, and it's, for me, it's important to acknowledge that there are kind of multiple related forms of youth engagement and participation and action. So we have participatory action research, where there's a real focus on generating research and evidence, youth organizing and advocacy, youth-led planning and design thinking, and also there's important citizen science approaches. In my work as a scholar, my questions are about how does youth-led participatory action research affect the individual youth who participate in a range of different ways, but also the settings and systems, the school systems or health systems in which they participate. So one empirical example of this is a study that I conducted in San Francisco Unified with San Francisco Peer Resources. We had 40 high school classes randomized to either participate in participatory research or in standard peer education. Students worked on a range of different topics, and if you'd like to know what we found, there's no time for data presentation today, but there's a handout that that Lauren has that will be coming around that has a link, that has both user-friendly abstracts and then a link to some online resources to support this work. So there are many current big questions and opportunities in this area. How do we scale these kinds of approaches? How do we work across sectors? How does technology help this kind of scaling of high quality participation? And just one second. So there are also important opportunities around new budgeting systems in California that mandate youth participation, and also an international growing consensus about the importance of adolescent health and development, such as exemplified in the new Lancet Commission on Adolescent Health that I and others in our school are participating in. So I just wanted to close by sharing that a growing number of us here at the School of Public Health and also across campus have banded together to form Innovations for Youth, which is a center focused on these upstream structural environmental effects on adolescents' health and how and sort of engaging youth as agents in improving it, as well as a new initiative funded by the Vice Chancellor for Research Office focused on youth and inequalities. So any of you who would like to learn more, I think Coco Auerswald is in the room, I'm here, and Dola Prata perhaps, but many of us, we'd love to talk with you more and love to get you engaged. So thank you very much.